I wanted to show you specifically my setup for how I do an ultrasound guided cortisone injection for trigger finger. You can see X marks the spot already. I've used chlorhexidine to clean the area, but notice I have her actually lying on her side. I find it's easier to try to turn that hand up and supinate that hand. Sometimes that's hard if they're on their back. The other thing I like to do is I like to have my table really high, and I like to have some type of bolster underneath their hand, because I find positioning of the patient is 80% of the success of your procedure. I have my ultrasound on the other side of the patient too, so I'm just looking straight ahead. So this is a key setup for me, and then I'm gonna do gel right here. And then after I do that gel, I'm gonna use my ultrasound like this. And I put it on. Sometimes I'll even I'll grab my assistant or my nurse, and they might even take this other finger and pull that finger down. I find you have to get really close. You have to get close to my point of entry is close to the end of the probe, or sometimes almost underneath the probe. So I'll come down on top of this, and it's a very, very shallow angle. I'll have you come take a look almost over my shoulder. So it's a very, very shallow angle like this when I do my injection. So this is the setup for an ultrasound guided cortisone injection for trigger finger.